Question 1. Musculoskeletal system. Joint disorders. A 40-year-old male patient presents with pain and swelling in his left knee after participating in an intense recreational soccer game. Upon examination, there is localized warmth and tenderness around the medial aspect of the knee with limited range of motion. MRI results confirm a medial collateral ligament (MCL) sprain. What is the most appropriate initial management for this patient? A. Prescribe corticosteroid injections to reduce inflammation. B. Begin with a rehabilitation program focusing on strengthening and stretching exercises. C. Apply a brace to immobilize the knee and recommend rest for several weeks. D. Immediate surgical intervention to repair the MCL. Answer. C. Apply a brace to immobilize the knee and recommend rest for several weeks. Explanation. A medial collateral ligament (MCL) sprain is a common injury resulting from acute trauma to the knee, especially during activities like soccer. Initial management typically involves RICP, rest ice compression, elevation, along with bracing to protect the ligament and limit further stress. The goal is to manage inflammation, prevent further injury, and promote healing. Surgical intervention is generally not required for mild to moderate MCL sprains, and rehabilitation is typically initiated once the acute symptoms subside. Corticosteroid injections, option A, are not first-line treatments for MCL sprains due to potential risk of weakening the ligament. Immediate surgery, option D, is reserved for severe cases, which this scenario does not suggest. Question 2. Neuromuscular system. Neurological disorders. A 65-year-old patient with a history of Parkinson's disease presents to physical therapy for gait and balance training. She reports difficulty walking, frequent falls, and postural instability. Upon evaluation, she demonstrates bradykinesia, rigidity, and a shuffling gait. Which of the following therapeutic interventions would be most beneficial for improving her mobility? A. Implementing high-intensity resistance training to build muscle strength. B. Focus on vestibular rehabilitation exercises to improve balance. C. Introducing functional electrical stimulation (FES) to improve gait. D. Teaching the patient relaxation techniques to reduce rigidity. Answer. C. Introducing functional electrical stimulation (FES) to improve gait. Explanation. Parkinson's disease (PD) is progressive neurodegenerative disorder affecting the central nervous system, particularly motor control. Functional electrical stimulation (FES) has been shown to be effective in improving gait in patients with PD, especially in those experiencing bradykinesia, slowness of movement, and gait difficulties. FES can stimulate muscles involved in walking to enhance coordination and functional mobility, while resistance training, option A, is beneficial for strengthening muscles. It does not directly address the gait impairments in PD. Vestibular rehabilitation, option B, is used for patients with vestibular disorders and does not address the core motor issues in Parkinson's disease. Relaxation techniques, option D, may help with managing rigidity but do not significantly impact gait function. Question 3. Scenario-based question. Geriatric physical therapy. Mrs. Thompson, a 72-year-old female with a diagnosis of osteoarthritis in both knees, reports difficulty with activities of daily living, adults, such as walking, climbing stairs, and standing from a seated position. She has been using a cane for the past 2 years, but still experiences pain and instability. Her physical therapist evaluates her and notes limited knee flex and extension along with joint tenderness. The therapist is considering prescribing an assistive device to enhance her functional independence. Which of the following would be the most appropriate assistive device for Mrs. Thompson in this case? A. A walker with 4 wheels and a seat. B. A knee brace to support joint stability during movement. C. A crutch for additional weight-bearing support. D. A standard cane with a wider base for improved balance. Answer A. A walker with 4 wheels and a seat. Explanation. For geriatric patients with osteoarthritis and significant mobility limitations, a walker with 4 wheels and a seat is often the best option as it provides the necessary support for weight bearing and balance. This assistive device can reduce the load on the knees and offer greater stability during ambulation. It is particularly beneficial for patients who experience instability or pain with walking. In Mrs. Thompson's case, a knee brace, option B, might help with joint stability but does not offer the same level of support for mobility. A crutch, option C, would require good upper body strength and coordination, which may be challenging for older adults with osteoarthritis. A cane with a wider base, option D, might improve balance but still lacks the stability and support that a walker can provide, especially when the patient needs to rest. Question 4. Cardiopulmonary system. Cardiovascular conditions. A 58-year-old male with a history of myocardial infarction is referred to physical therapy for post-cardiac rehabilitation. He has been stable for 4 weeks after his MI, and his physician has cleared him for light physical activity. During his initial evaluation, he reports occasional shortness of breath with exertion, but otherwise his vitals are stable. Following interventions is the most appropriate for this patient in the early stages of cardiac rehabilitation. A. Initiate high-intensity interval training (HIIT) to improve cardiovascular endurance. B. Begin with low-intensity aerobic exercises such as walking on a treadmill. C. Focus on strengthening exercises for the lower extremities only. D. Recommend vigorous resistance training to enhance muscle strength. Answer: B. Begin with low-intensity aerobic exercises such as walking on a treadmill. Explanation: in the early stages of cardiac rehabilitation, it is crucial to begin with low-intensity aerobic exercises to allow the heart to gradually adapt to increased physical activity without overwhelming it. Walking on a treadmill at a low intensity is a suitable intervention for this patient, as it promotes cardiovascular health while minimizing stress on the high-intensity interval training (HIIT) option A is not recommended in the early stages of rehabilitation due to the increased cardiovascular stress. Strengthening exercises option C and resistance training option D are important components of cardiac rehabilitation but are typically introduced later once cardiovascular endurance has been established. Question 5. Integumentary system. Wound care. A 50-year-old diabetic patient presents with a non-healing ulcer on the bottom of his foot. The wound is approximately 3 centimeters in diameter, has a pale dry base, and exhibits moderate drainage. The patient reports poor circulation in his lower extremities. Which of the following interventions would be most beneficial for this patient to promote wound healing? A. Apply a hydrocolloid dressing to maintain a moist wound environment. B. Use a dry gauze dressing to absorb excess exudate. C. Recommend debridement of the necrotic tissue using sharp debridement. D. Prescribe a silver-based antimicrobial dressing to prevent infection. Answer: A. Apply a hydrocolloid dressing to maintain a moist wound environment. Explanation: for diabetic foot ulcers, maintaining a moist wound environment is essential to facilitate healing and promote granulation tissue formation. Hydrocolloid dressings are effective for this purpose as they provide moisture and insulation while promoting autolytic debridement. Dry gauze option B is less effective for promoting a moist environment and other tissue damage by adhering to the wound. Sharp debridement option C is used when there is significant necrotic tissue but is not always necessary unless infection is present or the wound shows signs of stagnation. Silver-based antimicrobial dressings option D may be used for infection prevention but should be used selectively and not as the first choice for wound management unless there are signs of infection. Question 6. Systemic pathology. Rheumatologic conditions. A 45-year-old female presents with joint pain and stiffness in her hands, wrists, and knees. She also reports morning stiffness lasting more than an hour, along with fatigue and general malaise. Upon physical examination, there is swelling and warmth in the affected joints, and blood tests show a positive rheumatoid factor (RF) and elevated erythrocyte sedimentation rate (ESA). Based on these findings, what is the most likely diagnosis for this patient? A. Osteoarthritis. B. Rheumatoid arthritis. C. Lupus erythematosus. D. Gout. Answer: B. Rheumatoid arthritis. Explanation: the symptoms of joint pain, morning stiffness, and fatigue, along with the positive rheumatoid factor and elevated ESA, are consistent with the diagnosis of rheumatoid arthritis, rise an autoimmune condition characterized by symmetrical joint involvement and systemic inflammation. Osteoarthritis option A typically presents with joint pain and stiffness, but it is more common in weight-bearing joints and does not cause systemic symptoms like fatigue or elevated inflammatory markers. Lupus erythematosus option C may present with joint symptoms, but it is also associated with other systemic manifestations such as skin rashes, which this patient does not exhibit. Gout option D typically presents with acute local pain in a single joint, often the big toe, and is caused by uric acid crystal deposition, which is not suggested by the patient's presentation. Question 7. Pediatric physical therapy. Developmental milestones. A 3-year-old child is referred to physical therapy for an evaluation of motor development. The child has difficulty running, jumping, and climbing stairs. The therapist notices poor coordination and difficulty maintaining balance. The child's history reveals no neurological conditions, but the parents are concerned that the child is not meeting age-appropriate milestones, which therapists prioritize during the initial intervention. A. Focus on improving fine motor skills like hand-eye coordination. B. Begin with strength training exercises for the lower extremities. C. Implement gross motor activities such as balance exercises and jumping. D. Recommend neurodevelopmental therapy to address coordination deficits. Answer: C. Implement gross motor activities such as balance exercises and jumping. Explanation: at 3 years old, children are typically refining their gross motor skills, including running, jumping, and climbing stairs. Since this child is struggling with these activities, the therapist should prioritize gross motor interventions to enhance balance, coordination, and strength. Exercises that focus on balance and jumping will help improve these fundamental motor skills. Fine motor skills, option A, are important, but are secondary to gross motor skills at this stage. Strength training, option B, may be beneficial, but is not the immediate focus for this age group, especially if the child has coordination deficits. Neurodevelopmental therapy, option D, is more commonly used for children with specific neurological diagnoses and is not indicated here, as there is no neurological condition suggested. Question 8. Neuromuscular system. Neuromuscular re-education techniques. A 60-year-old patient recovering from a stroke presents with difficulty with gait and coordination, particularly with the left leg. The patient has mild hemiparesis on the left side and some spasticity in the left ankle. Which of the following techniques would be most beneficial in improving the patient's gait? A. Constraint-induced movement therapy, CIMT, to encourage the use of the affected limb. B. Functional electrical stimulation, FES, for the left lower extremity. C. Rhythmic stabilization exercises for the trunk. D. Proprioceptive neuromuscular facilitation, PNF, patterns for the lower extremity. Answer: B. Functional electrical stimulation, FES, for the left lower extremity. Explanation: Functional electrical stimulation, FES, is an effective technique for improving gait in patients with hemiparesis or spasticity following a stroke. It works by stimulating the muscles of the affected limb to improve movement, coordination, and overall function. CIMT, option A, is more effective for improving arm use in patients with unilateral neglect, severe upper extremity impairments, and may not be the best choice for lower extremity deficits. Rhythmic stabilization exercises, option C, can help with trunk control and stability but do not directly address the lower extremity weakness or spasticity. PNF patterns, option D, may assist with movement patterns but are not as specific for improving gait as FES. Question 9. Evidence-based practice. Outcome measurement. A physical therapist is considering implementing a new treatment approach for patients with chronic low back pain. To assess the effectiveness of this intervention, the therapist decides to use a validated outcome measure to evaluate the patient's pain levels, functional status, and quality of life before and after treatment. Which of the following characteristics is most important when selecting an outcome measure for this study? A. The outcome measure must be quick and easy to administer. B. The outcome measure must be reliable and valid for the specific condition. C. The outcome measure must be designed for pediatric patients. D. The outcome measure must be universally applicable to all musculoskeletal conditions. Answer: B. The outcome measure must be reliable and valid for the specific condition. Explanation: when selecting an outcome measure for a study or clinical practice, it is crucial that the measure is both reliable, produces consistent results, and valid, measures what it is intended to measure for the specific condition being treated. In this case, the outcome measure should be validated for assessing chronic low back pain and its associated functional limitations. 1. Important for the measure to be quick and easy to administer, option A. This should not outweigh its reliability and validity. Pediatric outcome measures, option C, are not appropriate for adult chronic low back pain. A universally applicable measure, option D, may not capture the specific nuances of the condition in question. Question 10. Musculoskeletal system. Soft tissue injuries. A 28-year-old runner presents with a recent history of sharp pain in the anterior aspect of the lower leg, particularly with running and prolonged standing. Upon examination, the therapist identifies tenderness along the tibial border and swelling in the lower leg. The diagnosis is anterior shin splints. What is the most appropriate treatment strategy for this condition? A. Ice application and stretching exercises to alleviate tension in the shin muscles. B. Corticosteroid injections to reduce inflammation. C. Immediate rest and avoidance of weight-bearing activities for 6 weeks. D. Surgery to release the tension on the tibial fascia. Answer A. Ice application and stretching exercises to alleviate tension in the shin muscles. Explanation. Anterior shin splints are commonly associated with overuse of the tibialis anterior muscle, leading to microtrauma and inflammation along the tibial border. Treatment should include ice application to reduce swelling and inflammation, as well as stretching exercises to relieve tension in the affected muscles. Rest option C is important but should not prolong for 6 weeks without addressing the underlying cause. Corticosteroid injections, option B, are not typically recommended for shin splints as they may weaken the tissue and delay healing. Surgery, option D, is not indicated for shin splints unless there is a severe or persistent condition that does not respond to conservative treatments, which is rare. Thus, conservative management with ice and stretching exercises is the most appropriate course of action. Question 11. Orthotic management. Foot and ankle conditions. A 45-year-old patient with a history of plantar fasciitis is referred for an orthotic assessment. The patient reports persistent heel pain, especially in the morning when getting out of bed, and pain with prolonged standing or walking. Upon examination, there is tenderness over the plantar fascia insertion on the heel, and the patient exhibits limited dorsiflexion of the ankle. Which of the types of orthotics would most effectively address this patient's condition? A. A soft insole to cushion the heel. B. A rigid, custom-molded insole with arch support. C. A metatarsal pad to relieve pressure on the forefoot. D. A heel lifter to reduce stress on the Achilles tendon. Answer. B. A rigid, custom-molded insole with arch support. Explanation. For plantar fasciitis, the goal of orthotic intervention is to support the arch, reduce tension on the plantar fascia, and provide cushioning. A rigid, custom-molded insole with arch support, option B, can help in redistributing pressure and improving foot mechanics, reducing strain on the plantar fascia. Soft insoles, option A, may provide some comfort but do not address underlying structural issues. A metatarsal pad, option C, is used for forefoot conditions like metatarsalgia, not for plantar fasciitis. A heel lift, option D, is typically used to reduce stress on the Achilles tendon and is not appropriate for plantar fasciitis as it can worsen the condition by further shortening the Achilles. Question 12. Neurological conditions. Stroke rehabilitation. A 72-year-old patient who suffered a stroke presents with right-sided hemiparesis and mild aphasia. During physical therapy, the patient has difficulty with motor planning and initiating movement on the affected side. Which of the following interventions would be most appropriate to address the patient's difficulty with motor planning? A. Mirror therapy to facilitate movement initiation. B. Constraint-induced movement therapy, CIMT, to encourage use of the affected side. C. Task-specific practice to focus on activities of daily living, ABLS. D. Sensory stimulation techniques to increase awareness of the affected side. Answer A. Mirror therapy to facilitate movement initiation. Explanation. Mirror therapy is an effective intervention for individuals with hemiparesis or motor planning difficulties following a stroke. It works by using a mirror to reflect the unaffected limb's movement, tricking the brain into thinking that both limbs are moving. This can improve motor planning and initiate movement on the affected side. Constraint-induced movement therapy, CIMT, option B, beneficial for improving motor function but is more appropriate when there is good potential for recovery of motor skills on the affected side, which may not be the case for this patient. Task-specific practice, option C, can be helpful once basic movement initiation has been addressed but is not the initial focus. Sensory stimulation, option D, may increase awareness of the affected side but does not specifically target motor planning. Question 13. Cardiopulmonary system. Respiratory conditions. A 55-year-old male with chronic obstructive pulmonary disease, COPD, presents for pulmonary rehabilitation. He has mild shortness of breath with moderate exertion but denies chest pain or dizziness. He has a reduced exercise tolerance and his oxygen saturation levels drop slightly during physical activity. Which of the following interventions would be most beneficial? This patient's rehabilitation program: A. High-intensity interval training, HIIT, to improve cardiovascular fitness. B. Inspiratory muscle training to increase lung capacity. C. Continuous positive airway pressure, CPAP, therapy during exercise. D. Supplemental oxygen therapy during exercise to maintain oxygen saturation. Answer. D. Supplemental oxygen therapy during exercise to maintain oxygen saturation. Explanation. For patients with COPD, Supplemental oxygen therapy during exercise helps maintain adequate oxygen saturation levels, reducing the risk of hypoxemia and improving exercise tolerance. High-intensity interval training (HIIT) option A can be beneficial for cardiovascular fitness but may not be appropriate for this patient due to risk of hypoxia. Inspiratory muscle training option B may help strengthen the respiratory muscles, but does not directly address the issue of oxygen saturation during exercise. CPAP therapy option C is typically used for sleep apnea and is not indicated during exercise unless the patient has specific indications for it, such as obstructive sleep apnea. Question 14. Geriatrics. Fall prevention. A 78-year-old female presents to the clinic following a recent fall at home. She reports difficulty with balance and dizziness, especially when standing up quickly. She has a history of osteoarthritis in both knees and has a fear of falling. Which of the following interventions is most appropriate to help this patient reduce her fall risk? A. Prescribe a walking aid for all mobility tasks. B. Focus on strength and balance exercises, particularly lower extremity strengthening. C. Recommend wearing supportive shoes at all times. D. Advise the patient to avoid all physical activity to prevent further falls. Answer. B. Focus on strength and balance exercises, particularly lower extremity strengthening. Explanation. The most effective approach to fall prevention in older adults includes exercises that improve strength, balance, and coordination. Strengthening the lower extremities, option B, will enhance stability, and balance exercises will improve postural control. Prescribing a walking aid, option A, may be necessary if the patient has significant deficits, but it should not be the primary intervention. Wearing supportive shoes, option C, is helpful but should be combined with exercise to address the underlying cause of the fall risk. Advising the patient to avoid physical activity, option D, can lead to deconditioning and further increase fall risk. Question 15. Musculoskeletal system. Arthritis management. A 60-year-old patient with knee osteoarthritis OA presents to physical therapy with complaints of joint pain, stiffness, and decreased range of motion. The patient is overweight and has difficulty performing daily activities due to the pain. Which of the following interventions would be most appropriate for this patient? A. Focus on weight loss through diet and exercise. B. Prescribe high-impact exercises to strengthen the knee joint. C. Recommend surgery to replace the knee joint. D. Teach joint protection techniques and emphasize rest. Answer A. Focus on weight loss through diet and exercise. Explanation. Weight loss through diet and exercise is a key intervention for patients with knee OA, as it reduces the load on the knee joints and can alleviate pain and improve function. High-impact exercises, option B, may worsen symptoms in individuals with OA due to joint degeneration. Surgery, option C, is a last resort and not appropriate for all patients with knee OA. Protection techniques, option D, can be beneficial, but they should not replace active interventions like strengthening and weight management. Question 16. Neurological rehabilitation. Spinal cord injury. A 32-year-old male with hitepinal cord injury is referred to physical therapy. The patient reports the ability to move his arms but has no movement or sensation below the chest. He is also experiencing difficulty in performing daily tasks such as dressing and transferring from a wheelchair. What is the most appropriate intervention to enhance the patient's independence? Daily activities. A. Focus on strengthening lower extremity muscles for potential future walking. B. Teach adaptive techniques for dressing and transferring. C. Prescribe an upper extremity weight-bearing exercise regimen. D. Begin long-term program of neuroplasticity training to regain sensation. Answer B. Teach adaptive techniques for dressing and transferring. Explanation. For patients with hitepinal cord injury, adaptive techniques are crucial in improving independence with activities of daily living. Adults, such as dressing and transferring. Strengthening lower extremities, option A, is unlikely to result in walking recovery at this level of injury. Upper extremity exercises, option C, are helpful for increasing function, but they do not directly address independence in daily activities. Neuroplasticity training, option D, is still in early stages of research and is not a primary intervention for regaining sensation or function in this case. Question 17. Musculoskeletal system. Hip osteoarthritis. A 58-year-old patient with hip osteoarthritis reports pain and stiffness, especially after prolonged sitting or walking. The patient is advised to try conservative management before considering joint replacement surgery. Which of the following interventions would most likely reduce the patient's symptoms? A. Prescription of a knee brace for joint stabilization. B. Corticosteroid injections into the hip joint. C. High-intensity exercise to improve muscle strength. D. Focus on low-impact aerobic exercises and strengthening exercises for the hip. Answer D. Focus on low-impact aerobic exercises and strengthening exercises for the hip. Explanation. Low-impact aerobic exercises such as swimming or cycling and strengthening exercises targeting the hip muscles are the most effective ways to manage hip osteoarthritis. These exercises help reduce pain and improve function. Corticosteroid injections, option B, may provide temporary relief but do not address the underlying cause. Osteoarthritis. A knee brace, option A, is not appropriate for hip osteoarthritis. High-intensity exercise, option C, might aggravate the condition and is not recommended for early-stage OA. Question 18. Cardiovascular rehabilitation. Post-myocardial infarction. A 62-year-old male is recovering from a myocardial infarction, heart attack, and is referred for cardiac rehabilitation. The patient is stable but expresses concern about engaging in physical activity due to the potential of further heart problems. Which of the following is the most appropriate approach for initiating exercise? A. Start with light aerobic exercise and monitor heart rate. B. Begin with high-intensity interval training to improve cardiovascular health. C. Encourage resistance training with heavy weights to strengthen the heart. D. Avoid exercise and focus solely on medication management. Answer A. Start with light aerobic exercise and monitor heart rate. Explanation. For patients recovering from a myocardial infarction, the key is to start with light aerobic exercise and gradually increase intensity, carefully monitoring heart rate and symptoms. This approach helps improve cardiovascular fitness while minimizing the risk of overexertion. High-intensity interval training, option B, and heavy resistance training, option C. Too strenuous in the early stages of recovery and could increase the risk of complications. Avoiding exercise, option D, is not recommended as physical activity is critical for recovery and long-term heart health. Question 19. Pediatric rehabilitation. Developmental delay. A 3-year-old child is referred to physical therapy for developmental delay. The child has not yet begun to walk and has difficulty with balance, coordination, and strength. Which of the following interventions is most appropriate for promoting the child's motor development? A. Begin walking practice with walker for support. B. Engage the child in age-appropriate, play-based activities to promote movement. C. Focus solely on strengthening the legs to improve standing. D. Limit movement activities to avoid further developmental delay. Answer B. Engage the child in age-appropriate, play-based activities to promote movement. Explanation. For young children with developmental delay, it is essential to encourage movement through play-based activities that are both engaging and developmental. These activities stimulate motor skills like balance, coordination, and strength in a natural and fun way. Using a walker, option A, may not promote the correct motor patterns and can sometimes natural development. Focusing only on leg strengthening, option C, does not address the overall motor development needs of the child. Limiting movement, option D, can exacerbate developmental delay and hinder progress. Question 20. Geriatric rehabilitation. Dementia and mobility. A 78-year-old patient with early-stage Alzheimer's disease presents for physical therapy. The patient exhibits mild cognitive impairment but is still able to walk with some difficulty due to muscle weakness. The caregiver expresses concern about falls. What is the most important goal for this patient's rehabilitation? A. Improve cognitive function through memory exercises. B. Focus on strengthening lower extremities and balance training. C. Begin gait training with assistive devices immediately. D. Concentrate on relaxation techniques to reduce stress. Answer B. Focus on strengthening lower extremities and balance training. Explanation. For patients with early-stage dementia, physical therapy should focus on improving strength, balance, and mobility to prevent falls. Strengthening the lower extremities, option B, will enhance the patient's ability to walk independently and safely. Cognitive exercises, option A, are important but are not as directly related to fall prevention. Gait training options may be useful, but it should be combined with strengthening and balance exercises for optimal results. Relaxation techniques, option D, are important but secondary to functional mobility goals. Question 21. Neuromuscular rehabilitation. Stroke recovery. A 70-year-old patient who recently had a right-sided ischemic stroke is undergoing rehabilitation. The patient experiences weakness and decreased coordination on the left side of the body. Which intervention is most appropriate to improve motor function and prevent contractures? A. Passive range of motion exercises for the left arm and leg. B. Focus on strengthening the right side of the body. C. Electrical stimulation of the left hand to improve grasp. D. Encourage weight-bearing exercises on the left side to improve strength and mobility. Answer: D. Encourage weight-bearing exercises on the left side to improve strength and mobility. Explanation: for patients recovering from a stroke, encouraging weight-bearing exercises on the affected side is essential for improving strength, motor coordination, and reducing the risk of contractures. Passive range of motion exercises, option A, are useful for preventing contractures, but they do not significantly improve strength or functional mobility. Strengthening the unaffected side, option B, is important, but it does not address the functional limitations on the affected side. Electrical stimulation, option C, may be helpful for improving hand function, but should be combined with other interventions to maximize recovery. Question 22. Pediatric rehabilitation. Cerebral palsy. A 5-year-old child with cerebral palsy is referred to physical therapy. The child has spasticity in the lower limbs and difficulty walking independently. The therapist aims to improve the child's gait and overall mobility. Which of the following interventions is most likely to be effective in this case? A. Passive stretching and splinting of the lower limbs. B. Weight-bearing activities and functional mobility training. C. High-intensity treadmill walking to promote endurance. D. Focus on upper extremity strength training for functional use. Answer: B. Weight-bearing activities and functional mobility training. Explanation: for children with cerebral palsy, weight-bearing activities and functional mobility training, such as walking with assistance, are crucial for improving strength, coordination, and gait. Passive stretching and splinting, option A, may help with spasticity but do not directly address functional mobility. High-intensity treadmill walking, option C, may be too advanced for a child. Severe spasticity and is not as effective as weight-bearing activities for this population. Upper extremity strength training, option D, can be helpful, but the primary focus should be on improving lower extremity function for mobility. Question 23. Musculoskeletal rehabilitation. Ankle injury. A 22-year-old athlete recently underwent surgery for an anterior cruciate ligament ankle tear and is in the early stages of rehabilitation. The patient complains of knee instability and difficulty returning to sports activities. Which of the following interventions should be prioritized in the early rehabilitation phase? A. Begin high-intensity plyometric training to enhance performance. B. Focus on quadriceps strengthening and proprioception exercises. C. Apply heat therapy to the knee joint to reduce inflammation. D. Introduce running drills to increase cardiovascular endurance. Answer: B. Focus on quadriceps strengthening and proprioception exercises. Explanation: in the early phase of rehabilitation following ankle surgery, it is important to focus on strengthening the quadriceps and improving proprioception, balance, and joint position sense. This helps restore knee stability and prevents further injury. High-intensity plyometric training, option A, and running drills, option D, are too advanced and can put strain on the knee in the early stages. Heat therapy, option C, is not the most effective approach for reducing inflammation. Ice therapy and elevation are better choices. Question 24. Geriatric rehabilitation. Osteoporosis. A 72-year-old female with osteoporosis is referred for physical therapy following a recent fall and vertebral compression fracture. The patient expresses fear of falling and a desire to improve balance and prevent further fractures. Which of the following interventions is most appropriate? A. Focus on high-impact weight-bearing exercises to strengthen bones. B. Teach balance training and fall prevention techniques. C. Use resistance training to increase muscle mass. D. Implement stretching exercises to increase flexibility in the spine. Answer: B. Teach balance training and fall prevention techniques. Explanation: for older adults with osteoporosis, balance training and fall prevention techniques are critical to reducing the risk of future fractures. Exercises that improve balance, coordination, and proprioception can significantly reduce fall risk. High-impact weight-bearing exercises, option A, are not recommended for individuals with osteoporosis as they could lead to further fractures. Resistance training, option C, is helpful for strengthening muscles but should be carefully tailored to the patient's limitations. Stretching exercises, option D, may improve flexibility but they are secondary or prevention in this case. Question 25. Neurological rehabilitation. Parkinson's disease. 60-year-old patient with Parkinson's disease presents for physical therapy. The patient is experiencing bradykinesia, postural instability, and tremors, which are impacting mobility and daily activities. Which of the following interventions would be most effective in improving the patient's function? A. Focus on high-speed aerobic exercise to enhance endurance. B. Implement program of rhythmic, repetitive movement exercises to improve motor control. C. Encourage the patient to remain as still as possible to reduce tremor. D. Focus on strengthening exercises for the upper extremities. Answer: B. Implement a program of rhythmic, repetitive movement exercises to improve motor control. Explanation: for patients with Parkinson's disease, rhythmic, repetitive movement exercises such as dancing or Tai Chi are effective for improving motor control, reducing bradykinesia, and enhancing overall movement patterns. High-speed aerobic exercises, option A, may not be well tolerated due to the motor symptoms of Parkinson's. Encouraging stillness, option C, could worsen symptoms like rigidity and tremor, while strengthening exercises, option D, are important. They are not the primary intervention for motor control in Parkinson's disease. Question 26. Post-surgical rehabilitation. Hip replacement. A 65-year-old patient has recently undergone a total hip replacement (EHR) surgery. The patient is now in the early stages of rehabilitation. Which of the following interventions is most appropriate during this phase of recovery? A. Initiate aggressive weight-bearing exercises to improve joint strength. B. Begin gentle range of motion (ROM) exercises to restore hip mobility. C. Focus on high-intensity strength training for the hip muscles. D. Promote standing for long periods to enhance hip stability. Answer: B. Begin gentle range of motion (ROM) exercises to restore hip mobility. Explanation: after hip replacement surgery, it is crucial to begin with gentle range of motion exercises to improve flexibility and mobility of the joint. This helps to avoid stiffness and restore functional movement. Aggressive weight-bearing, option A, and high-intensity strength training, option C, should be avoided early in the rehabilitation phase to prevent stress. Healing joint. Promoting prolonged standing, option D, could increase strain on the hip and may lead to complications. Question 27. Cardiac rehabilitation. Post-myocardial infarction. A 55-year-old male patient who recently had a myocardial infarction is beginning cardiac rehabilitation. Which of the following should be prioritized in initial stages of his rehabilitation program? A. High-intensity aerobic exercise to improve cardiovascular fitness. B. Gradual increase in physical activity, focusing on light aerobic exercises. C. Focus solely on resistance training to build muscle strength. D. Avoid all exercise and focus on lifestyle modification only. Answer: B. Gradual increase in physical activity focusing on light aerobic exercises. Explanation: for patients recovering from a myocardial infarction, it is essential to gradually increase physical activity, starting with light aerobic exercises to improve cardiovascular fitness and prevent complications. High-intensity aerobic exercise, option A, should not be introduced in the early stages as it can strain the heart. Resistance, option C, is beneficial but should be introduced later. Complete avoidance of exercise, option D, is not recommended as physical activity is vital for recovery. Question 20. Vestibular rehabilitation. Dizziness. A 50-year-old female is referred for vestibular rehabilitation following a recent diagnosis of benign paroxysmal positional vertigo (BP). The patient reports episodes of dizziness triggered by certain head movements. Which of the following interventions would be most effective for this condition? A. Teach the patient the epi maneuver to reposition displaced ocelles. B. Encourage the patient to avoid head movements entirely to prevent dizziness. C. Recommend strength training to improve postural stability. D. Focus on balance training using complex dynamic activities. Answer A. Teach the patient the Epley maneuver to reposition displaced otoliths. Explanation. The Epley maneuver is a well-established treatment for benign paroxysmal positional vertigo that helps reposition displaced otoliths in the inner ear, thus reducing dizziness and vertigo. Avoiding head movements, option B, is not an effective long-term solution and may limit function, while strength training and balance training, options C and D, important for overall vestibular rehabilitation. They are not specific treatments for EP. Question 29. Spinal cord injury rehabilitation. A 30-year-old male with a complete spinal cord injury is undergoing rehabilitation. The patient is currently using a wheelchair for mobility and expresses difficulty in transferring from the wheelchair to a bed. Which of the following strategies would be most appropriate to help improve his independence? A. Train the patient to use a sliding board for smooth transfers. B. Focus on strengthening the upper extremities to improve manual transfers. C. Begin gait training with a walker to encourage walking again. D. Avoid transfers altogether to reduce the risk of injury. Answer A. Train the patient to use a sliding board for smooth transfers. Explanation. A sliding board is a useful tool for individuals with a spinal cord injury to facilitate safe and smooth transfers from a wheelchair to other surfaces such as a bed. Strengthening the upper extremities, option B, is beneficial but may not fully address the patient's immediate need for transfer independence. Gait training with walker, option C, is typically feasible for someone with complete injury, as they are unlikely to regain the necessary motor function. Avoiding transfers, option D, is not an appropriate long-term solution. Question 30. Stroke rehabilitation. Dysphagia. A 58-year-old stroke patient is referred for rehabilitation after experiencing difficulty swallowing. Dysphagia. The patient is at risk for aspiration. Which of the following interventions should be prioritized in the rehabilitation plan? A. Encourage the patient to eat a variety of solid foods to improve nutrition. B. Refer the patient to a speech therapist for swallowing exercises and safe eating strategies. C. Provide high-calorie drinks to compensate for difficulty eating solid food. D. Recommend complete dietary restrictions to prevent aspiration. Answer B. Refer the patient to a speech therapist for swallowing exercises and safe eating strategies. Explanation. A speech therapist specializes in managing dysphagia and can provide exercises to improve swallowing function and techniques to reduce the risk of aspiration. While high-calorie drinks, option C, can be helpful for nutritional support, they do not address the root cause of dysphagia. Complete dietary restrictions, option D. A long-term solution, and encouraging solid foods, option A, can increase the risk of aspiration without addressing the patient's swallowing difficulties.